transition to the next category, which is housing affordability and quality. And I'm going to invite Jonathan Kumar from Samaritan to join. Thanks, Jonathan.
Test. Can you hear me?
Yes.
Okay, nice. Yeah, when you don't have a stable home, it's really, really bad for your health. When you're exposed to the heat, to abuse, to a lack of sleep, it's just about impossible to take the difficult, consistent action steps needed to attain stable housing, income, and health. You see it on the streets of your cities every day and in every hospital and ED. Next slide. Samaritan is an engagement platform that helps people access financial and social support to complete the action steps necessary to reach housing, income, and health goals within 12 months. We work with health plans and health systems who designate a target population to get connected to Samaritan. From there, we equip existing frontline care teams to use Samaritan to engage this population. Folks get to share life goals with the care teams and then start getting direct funding under the fancy card you see on the right there, and social support for taking action steps towards those goals. It could be $5, $10, $20 plus text messages of support for submitting a job application, showing up for a meeting, making it to the clinic this week. Members can use the funds with their caregiver for things like footwear, bus fare, debt payoffs, or just to keep a cell phone on the grid. Over time, this raised engagement with appropriate care and better addressed needs has led to life-changing outcomes. Kaiser Permanente's research group found that Samaritan has helped nearly quadruple care plan completion rates, reduce ED visits by 21%, and lower cost of care by up to 54% compared to matched populations, with the care teams giving the platform top marks for the impact it's had on their work. These outcomes have helped us partner with Elevance, Molina, Humana, Aetna, Centene, and other regional partners in Washington, California, Kentucky, Maryland, and New York. And we'd love to talk to you about getting this resource out to priority populations and care teams in Colorado, Virginia, and New Mexico. Thank you.
Thanks, Jonathan. All right, so we will transition now to hearing from Jake Rothstein from Upside. Welcome.
Good afternoon, everyone. My name is Jake. I'm the CEO and founder of Upside. Upside is the only scalable housing stability platform purpose-built for health plans. We help Medicaid and Medicare plans identify at-risk members, get them into safe, appropriate housing quickly and at scale. I experienced this problem in my own family. My grandmother faced housing instability that wasn't really obvious on paper, but it was real. Her home became unsafe, her access to care broken, and no provider, no plan, no system seemed really equipped to respond. And that's when I realized this wasn't a gap in just care, it was a gap in housing, and nobody was solving for it. Housing is healthcare, and yet health plans aren't housing experts, and housing providers can't reach the people who need them. And this disconnect is costing the system over $70 billion a year in avoidable medical costs. We built Upside to close that gap. We're already live in Virginia with housing inventory mapped and operators lined up across 42 states, and we're ready to launch in Colorado and New Mexico. Every member we support gets a dedicated care guide who can communicate in any language and is specifically trained in housing. And our team is virtual because we've proven that it can deliver greater impact that way. Our model is fast, scalable, and focused. Our care guides specialize in housing and only housing, and they're backed by a national ops team leveraging purpose-built technology that sources inventory in real time, even in rural markets. We don't hand members a list and wish them luck. We walk with them step by step, recovering IDs, understanding credit, navigating vouchers, engaging landlords, and getting them housed. Let me give you an example. A mother of 6 living in her car, she told us, "I just want my kids to have a bedtime again." 68 days later, she had a lease, a kitchen, her children were back in school full time, her anxiety eased, her family had stability. And this isn't a one-off. 97% of referred members enroll in our program. We reduce inpatient admissions, avoid readmissions, and lower ER use. Satisfaction is consistently high, and plans scale with us because we outperform traditional models on cost, speed, and results. Because once someone has a stable place to live, everything else becomes possible. Clinical care, behavioral health, nutrition, transportation, and so much more. We're not trying to be everything. We're solving the hardest problem first, the part that unlocks everything else. So if you're looking for a partner who could deliver housing outcomes at scale, we're ready to go.
Thank you, Jake. Appreciate that. And you all have been doing great with staying on time. So now we're going to make a shift over to transportation services. And I am going to first turn it over to Mindy Kniebel from Kaizen Health.
Hi, everyone. My name is Mindy Kniebel, and I'm the founder and CEO of Kaizen Health. We are a logistics platform that was developed to eliminate transportation as a barrier to living a healthy and happy life. We actually are celebrating our 9th birthday tomorrow, and we got here because my own family struggled to get access to care. So while I don't love the reason we got here, I love the impact we've been able to make. So what we do is we partner with health plans, health systems, state agencies, nonprofits, 20 different client segments to make sure that folks have access to not only clinical care, but to access to food, access to housing, access to education, employment, the justice system. We're really focused on the whole person. We not only can move people from A to B, but we can move stuff from A to B. And that stuff can be anything from food to prescriptions, DME. We're actually getting into the organ transplant space. So we've done up to tissue to this point and making the jump into organs. So very excited about that. There's really a few different parts to Kaizen. So we have our transportation network. What I'm going to say next is probably going to surprise you guys because it still surprises me today, 9 years in. We have 36 levels of transportation. I didn't know that many exist. I thought it was like cars, trucks, semis. I don't know. But we have 36 levels of transportation. Just think of a menu that you could select from. They're all credentialed at the different levels of service. That can be, I grew up in a small town in Iowa where it could be like a volunteer network, one car taxi company, up to, huge organizations like Uber and Lyft, and ambulance companies and everything in between. We have our platform that powers everything that we do. We can help you with your plan design, but as I like to say, we are the rule enforcer, not the rule maker. So we can enter all of your rules so that all of your members are compliant in the trips that they are taking, whether it's distance, number of rides, where they're going, etc. And then the technology also really allows us to meet the member where they are. And we offer up to 57 languages in text messages, about half that in voice calls to communicate updates on rides. We also have mobile apps for those who are more technologically inclined. And then you can still call us if that is the preference.
Hi, Mindy. I am lovingly coming in to cut you off.
Well, we'll talk about the community health worker stuff later. Apparently, I'm a little under the weather, so I don't think I was at my top of my game on this. So, exciting stuff in the breakout sessions.
Yes, thank you. More time in the breakout sessions. All right, thank you. So, Sam from Round Trip, I welcome you to come share your story.
Great. Hey, everyone. I'm Sam Farmer, the CEO here at Round Trip. Our founder actually started his career working on the back of an ambulance. And time and again, what he saw was patients who were actually giving up on their health care because the transportation logistics were just so complex and frustrating. So in 2016, Round Trip was born. Since launch, we've helped over 1 million patients get access to outpatient appointments, SDOH needs, and ensure safe and timely discharges and transfers from inpatient as well. Overall, this drives for you improved adherence, streamlined operations, and overall a reduced cost of care. We are a tech-enabled services company, and at our core is a configurable software platform. We do not own vehicles, we don't employ drivers, but we use tech and integrations to aggregate the transportation supply in a given geography, and then we efficiently assign the transportation requests for all levels of non-emergency ground transportation. You can bring your own preferred network, or we can help you build one as well. We tailor our platform to match your transportation benefit design, limitations, co-pays, anything you can imagine. And we've got booking options for patients and members to book directly, as well as for facilities and care teams to schedule on behalf of members. Plan staff will have access to on-demand reporting covering all sorts of metrics and satisfaction information. We've got best-in-class fulfillment, industry-leading low grievance rates, and wrapped around all of this is a 24/7, 365 navigation center that is on call to help members book rides, troubleshoot issues, or just provide support as needed. Our customers include health systems, ACOs, Medicaid, Medicare Advantage plans, paratransit organizations, some in the states that are represented here, And our team has expertise not only on the ins and outs of building and designing a transportation benefit, but all the workflows that health systems are using to coordinate and ensure access to care for patients. So this positions us really not only just as a vendor, but a data-driven thought partner in tackling some of the hardest logistical challenges in healthcare. We're super excited to see you in our breakout sessions and dig deeper into how we partner, and looking forward to chatting.
Thank you, Sam. I would love to welcome our last pitch for today from the Health-Related Social Needs Navigation Services. Welcome Kwame Liddell from ThriveLink, we will allow you to go ahead and get started.
Hi, I'm so happy to be here. My name is Kwame Liddell. I'm the founder and CEO of ThriveLink, where we build AI agents that talk to families over the phone and help them sign up for things like Medicaid, utility assistance, food stamps, transportation, and more. And I'm an emergency department nurse, and I worked in Alameda Health System, which is the county in Oakland, an incredibly diverse and complex population. And we saw that 30% of our patients didn't need more healthcare. They needed food, housing, transportation. They needed to afford their medications. They needed help finding a doctor. And we as nurses, we understood the system. There was every program that you could think of, but there was no way for us to actually get someone into those programs in real time. And we would continue to see them progress through the sicknesses that could have been prevented. And we built ThriveLink to completely transform that experience and let families have a simple phone call. If they don't need a smartphone, they don't need the ability to read, have a simple phone call, communicate and answer the questions necessary for signing up for Medicaid or housing and all those things, and receive those resources in one stop in a way that's easy for them. It works in 75 languages. And I'll just talk a little bit about the change that we're seeing. We supported thousands of families. Some things that we're seeing is that families for the first time are able to get assistance with these programs, especially if they have trouble reading. They're able to get it after 6 p.m. We see moms calling after at 11. We can hear the videos. I mean, we can hear the audios, and it's really cool. And we can hear families with children in the background. We can hear them washing dishes and all of these things, making the paperwork that's really a huge barrier for health plans, making that paperwork an afterthought, something that they can multitask and do. And that's really what we want to see. I'd love to talk to you more and share some more stories. Thank you.
Great. Thank you, Kwame. And thank you to all of our great presenters today. I'm super excited.